This is the second in my series on imaging studies and disability, and in this video I'm going to talk about CT scans, computed tomography scans. I'm going to talk about what they are, what they're useful for, what they're not so useful for, and how they can help in a disability application. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, before I get started, I had a good comment on my first video, which was on X-rays, and a person asked about the risk of radiation from having bone density X-rays, which are used to diagnose osteoporosis. And as I stated in that video, all X-rays carry a risk of cancer down the line. The more radiation, the higher the risk. And bone density X-rays use a very low amount of radiation, about the same amount as a chest X-ray. So the risk is quite low, but it's not zero. And that brings up an important point. Doctors should never order a test unless they have a good reason for it. Everything we do in medicine carries some risk and some reward, and we always need to balance the two. Will the reward be greater than the risk? As an example, I've had a patient who died from taking aspirin, something most people would consider low risk. The second thing is a doctor should never order a test unless they know what they'll do with the result. I've stated before that one of my gripes with new physicians today is that they don't take medical histories and examine patients. They stare at laptops and order tests. And I think in many cases they have no clue what they'll do if a test comes back abnormal. Here are some questions that a test may at times help with. Should the person have surgery? If so, what type of surgery? Should the person be prescribed medication? If so, what medication? Should the person have therapy, for example, physical therapy? If so, what sort of therapy? What is the prognosis? What is likely to happen in the future? Always bearing in mind that doctors are terrible at predicting the future. What is the average life expectancy with the condition the person has? What is the likelihood of the person being able to return to normal activities or to return to work? Are they likely to need care in a hospital, nursing home, or with home health care? And finally, reassurance. All doctors sometimes encounter patients who are terrified of the possibility of having a certain condition, often for good reason, such as, for example, a close relative died of the condition. In this case, knowing whether the patient has the condition or not will not only help the doctor decide what sort of treatment is needed, but often will provide tremendous reassurance for the patient if they discover they do not have the condition. So let's talk about CT scans. And CT scans are basically fancy X-rays. In a CT scan, instead of an individual picture being taken, as is done in normal X-rays, a whole bunch of X-rays are taken in a circular machine like a big ring that the patient lies in. Then, by some sort of computer magic that I have no clue about understanding, those pictures are put together into CT scan images. The biggest advantages of CT scans are, number one, They overcome the number one drawback of regular X-rays, namely, they show soft tissue quite clearly. As an example, if you take an X-ray of the stomach of a person, you'll just be able to see a vague outline of their liver. However, if you do a CT scan of that person's abdomen, you'll get beautiful images of the liver in great detail. CT scans take the person and essentially slice them up like slicing a cheese. The slices can be transverse. The original CT scans were only transverse. They can be coronal, which is like this, or they can be sagittal, which is slices like this. And once you've done a CT scan, you can get transverse, coronal, and sagittal images by computer magic from the same CT scan. The other advantage of CT scans is that they show bones in more detail than anything else, even better than regular X-rays. CT scans are particularly useful for looking at very complicated bones, such as the bones of the skull, face, and spine. There are certain conditions where X-rays and CT scans of bones are extremely useful. For example, in a person where there's a strong suspicion of a broken neck. A CT scan shows neck fractures better than regular neck X-rays, and sometimes fractures can be missed on regular X-rays that will show up clearly on a CT scan. However, CT scans expose the person to a significant amount of radiation, and they're expensive. So there are conditions where a CT scan or even an X-ray should not be done. An example is a possible fracture of one of the small toes. It doesn't matter if the toe is broken or merely bruised or sprained, because the treatment is the same. The toe is taped to a healthy, uninjured toe next to it, and the person is able to walk immediately. Nothing else needs to be done. No casting, no surgery. So an X-ray or a CT scan will not change anything. A CT scan is very good for bleeding, and it is by far the best test for detecting acute bleeding in the brain. It's also an excellent test, the best test for detecting skull and facial fractures. So the CT scan of the head is the best thing to do in anyone who's had a significant head injury, because it will show if the skull is fractured, if the face is fractured, and if there's bleeding in the brain. A CT is the best test for blood clots in the lung. It's excellent for some pneumonias and some lung injuries, although not necessary for all pneumonias. It's very good for rupture of the esophagus, which is the swallowing tube, some abdominal tumors and abscesses, pancreatitis, which is inflammation of the pancreas, a digestive gland that lies behind the stomach, enlarged lymph glands anywhere in the body. It's the best test now for appendicitis. It's the best test for kidney stones, and it can be used for some colon cancer screening, not all. It is the best test for looking at complicated bone fractures and dislocations. Again, regular x-rays are all that are necessary for a simple fracture. For example, a fracture of the arm bone here, where you just have one long bone and you just need to see if it's broken, and if it's broken, is it at an angle or not. Doing a CT there is a waste of time and money. When you're thinking about a complicated fracture, such as a fracture of the spine, pelvis, or hip, a CT scan is better than a regular x-ray. It's very good for showing eroded bones, such as you get with arthritis, and it's good for some bone tumors and some bone infections. Just like regular x-rays, CT scans can be done with contrast that will provide more detail than the plain CT scan alone, and the contrast can be swallowed, given by an enema, or given by an injection. CT scans of the heart with an injection of the contrast show the blood vessels to the heart quite well and are good for detecting hardening of the artery. However, it's not the best test. The best test is a coronary angiogram, where a tube is put in an artery, threaded up into the heart, and then contrast is injected into the heart and into its arteries. The problem with the angiogram is that it's a complicated and expensive procedure, and there's a little risk. It can cause heart attack, and in rare circumstances, it can cause death. The advantage of an angiogram is because there's already a tube in the heart. If a serious problem is detected, such as the person's having a heart attack, or they have major blockage in one or more of their heart arteries, they can have a stent or more than one stent inserted. A stent cannot be inserted during a CT scan. So, for example, in somebody who's having an acute heart attack, you don't want to waste time by doing a CT scan. You already know there's serious heart trouble. You want to go straight to a coronary angiogram. Another advantage over other imaging studies is that CT scans can be done in people with magnetic metal in them, such as orthopedic hardware, pacemakers, and other medical appliances. MRIs cannot be done if the person has any magnetic metal. The MRI uses tremendously powerful magnets that will literally rip something magnetic out of a patient's body. CT scan won't do anything to the metal. However, metal in the body does degrade the CT images, makes them less high quality than if there was no metal in the body. Like most imaging, the radiologist is the specialist in looking at the images and interpreting them. Doctors usually become familiar with imaging in their line of specialty. For example, when I did emergency medicine, I saw many head-injured patients, and I became pretty good at looking at CT scans of the head, looking for skull fractures and bleeding in the brain. However, I have very little experience looking at CT scans of the abdomen, and I would not be able to tell whether somebody had appendicitis or not based on their CT scan. So in what conditions can a CT scan be helpful for disability? Well, first of all, any trauma to the head, face, or brain. Many brain conditions, such as most brain tumors. People think that an MRI tells all about the spine, and it does give a lot of information. But a CT scan is an excellent test for fractures of the spine, and also it's better than MRI for arthritis of the spine. CT is also very helpful for many conditions of the lungs, some conditions of the heart, and many conditions in the abdomen. And it's the best test for complicated fractures, as I stated earlier, fractures of the skull, face, spine, pelvis, and hips. Well, I hope this has been helpful. In my next video, I'm going to talk about MRIs and disability. And as always, remember, if it happens, it's possible.